All right, that looks good. All right, well, good morning, everyone. It's another Monday morning here at Health Plan Markets. Thank you guys for being on the call. It is getting real close to AEP. We are almost 1 month away from October 1st. This is still lock-in season, so we still got lots to do, but it's also certification season, so I'm going to be going through quite a bit of that. If there's something, I want to point this out, if there's something that you feel you're missing or seems off or you'd like to see more of before AEP and OE begins, again, annual enrollment period starts October 1st. You could start accepting plans October 15th. And then OE starts November 1st. So if there's something that you're like, something seems off, I don't know where to go, put it in the chat. Would love to hear how you're feeling on this. Thanks, Al. I combed my hair today. Appreciate that. All right, so here we go. First thing I want to do is jump into the training calendar. I think that's most important here. So I'm going to do that. Let me share my screen. All right. All right, here we go. Mike, Mike, I think we got an unmuted mic somewhere. Just heads up if you can watch that. All right, here we go. If you can see my screen, I'm just gonna roll. So thumbs up would be great. If you can see my screen, shoot me a thumbs up. All right, thank you, got it. HQ, here it is. First thing is, got it, thank you guys. Under learning and resources, you've got your training calendar. We're gonna pop that open. Again, this is where you're gonna find all the trainings that are relevant for you for the week. I like to put it in week mode so you can see what's going on. All right, we've got Steve from Innovage here this morning. He's going to talk to us about the PACE program and what they're doing in just a bit. Let's see, Elevance is doing their broker road shows. So this is Freedom, Optimum, Simply, and HealthSun. Those are all in the Elevance One Florida Broker Roadshow. So if you're selling one or all of those, really good idea to visit those. The first one is in Davie, Florida today. So if you're in South Florida, that'd be one to catch. There is the Chronic Special Needs Plans. That is tomorrow at 11. UHC is doing that one. Chronics continue to be a thing. The Elevance Broker Roadshow for Orlando is at 9 o'clock on Wednesday. So if you're in this market, catch that one. We've got our monthly advisor meeting. That is at Centerwell. It's showing Centerwell. That is also in Orlando from 10 to 1. Would love to see you there. Or if you're in the Tampa market, the Broker Roadshow is at the T. Pepin's Hospitality Center, looks like. So that's from 11 to 1 if you want to catch that one. And then on Friday, Part D program, the 2027 Part D program, if you're not up to speed on that, please check that out. It's going to be important. Okay, that's the training for the week. If you have any questions on trainings, I will say this, guys, rollouts happen once a year. So really, if you're out there selling and you want to kind of get caught up on what's going on out there, these don't happen often. So please attend. You know, this is your 2027 rollouts. So we expect to see some changes. I'm looking at the chat here. Rosie said that there's Baycare changes happening. I'm optimistic this will be a great opportunity to persist in this business and persevere. Love that. Al saying Baycare will be termed at Watson Clinic in Polk County. Thanks for the heads up. If we have any members that are at Watson Clinic on Baycare, you might want to check your book of business on that. We've got ways to do that very, very quickly. So if you need help with that, reach out to support@askhpm.com. Thanks for the heads up, Al. That's exactly the kind of stuff we need to see. All right, so I'm going to zoom in here and share what else is going on as far as updates and things that need to happen here. My logo broke this morning. I don't know what happened. September 7th, Health First 2027 broker kickoff. If you're planning to visit them, they are going to be in Melbourne, Deltona. They're doing a virtual session and the Spanish virtual session. The dates are in your email. If you're certified to sell Health First, or if you want to, please make sure that you go into contracting to get that done. Spark is hosting some AEP 2027 virtual kickoffs. Emails were sent on that. If you're interested in joining that, that's from 1 to 5 p.m. On August 25th and 26th. It's a long thing they're doing virtually. Seems painful. We'll see. We're going to do a version of that, but obviously we're going to condense it and make sure you get all the information that you need in a timely manner.
Incoming call.
We have got ready to sell and certification windows are live across almost all the carriers now. Just remember, guys, that in AEP, September is the last month to really get all your certifications done and get ready. You want to get your certs out of the way now. You got about a week left until 30 days out. So highly recommend that you get your certs done. If you're falling behind, you really need to refocus your energy on getting that stuff done. Some new things that I will let you know of. We got noticed that the PDP business at Aetna, all new PDP sales are non-commissionable for plan year 2027. This is another trend that we've talked about over the last year of non-commissionable plans. Aetna is adding all of their PDP products. Essentially, all new sales of PDP plans are non-commissionable, and that's across all states, all counties, and all hierarchy levels. If you have PDP business, you will continue to get paid on that renewal basis based on, the rates that it was launched at. So just know that there are non-commissionable. There are other MA plans that are non-commissionable. So we have a place where you can check that if you're getting confused. Go over. I'm going to share my screen really quick. You can go to the commissions tab, non-commissionable plans. The team has put together a really great, fully, cultivated area with all non-commissionable plans, easy to read, and it's searchable. So if you're like, you want to look by a certain plan, maybe PDPs, let's see if that works. Yeah, PDPs. So you can see all the PDP plans that are non-commissionable. Or if you want to search by carrier specifically, you can select Aetna, and you can see all the ones that are non-commissionable there. Or if you want to search by state, you can do that. Okay. That's Aetna, nothing there. So we go all carriers. So these are all the non-commissionable plans in Georgia specifically. So we're trying to keep up with this. It's going to happen fast and furious. We don't see them changing this until CMS changes this. Okay. I would hate for you guys to pitch a plan, your client falls in love with it, and then you don't get paid. That's a bummer. Okay. So, yeah, make sure you're reviewing this. It's important. Okay. Let's take a look. Looking at the Florida carriers, Freedom and Optimum. Let's see, the 2027 Medicare Part D producer contract addendum was launched. If you have certed for 2027, you did this right away on your, re-onboarding essentially. So they require you to, sign these addendums. Nothing really to do there except do your Freedom and Optimum cert for 2027 if you haven't done so already. Florida Blue agency ready to sell report has been updated. The 2027 product certifications for Florida Blue work for both 2026 and 2027. So if you are new and you're like, hey, I'm signing up for Florida Blue and I have a client to write immediately, your 2027 certification will certify you for 2026 as well. So that's pretty cool that they're able to do that. You still have to do your AHIP and then go into your ready to train tabs. This is for Medicare only. Just remember that. Florida Blue, ACA, you have to be captive to write that. That hasn't changed. Talked about the Health First kickoffs. Just know that that's still a thing. Solis has announced that their AEP 2027 materials are open for pre-order. There are invitations out for Tampa, Orlando, and South Florida through Evite links. So check that out in your inbox. Another reason why you want to check your inbox on this. WellMed and Optum, they've got some broker news. They're preparing for AEP. Great idea to link and sync with your docs. And then Doctors Healthcare Plans, which is new to Central Florida, but have been around for in South Florida. Check that out. The 2027 confirmations are flowing. So we're seeing that is working well. If you haven't done your AHIP, holy smokes, get that done. We've got a discount for you right up top. Oh, I'm still sharing that. Sorry, guys. It's right up top here on top of the screen here, and then I'll go back to my tab here. If you're doing Aetna Group Medicare, that was launched last week. So new and renewing brokers, if you're doing group Medicare products with Aetna, you can take your cert for that now. Kaiser Permanente is out for my Georgia folks. 2027 cert is ready. Prominence Health Plan, there's been some news about them. More to come about that, but they are still pushing South Florida specifically. They're doing 2027 broker kickoffs September 16th, which is coming up. Reminders here about tools and trainings. Aetna, they've got their 2027 enrollment kits and welcome guides. You can order those as of August 19th. That's last week. So you can get those ordered. If you like physical kits, this is the time that you can get that stuff done. Devoted Health. Their broker plans at a glances are live. You can download that, filter that by state inside your Devoted portal. Cigna Health Spring, their broker training calendar has been posted for all the products. Check that out. We're going to continue to try to link as much as we can inside our training calendar because there's just a lot happening all over the place. But just best practice, guys, is check your emails for trainings. Just do that, especially agency leaders. Like, you guys got to do that. I know it's a bummer, but you got to stay on top of your emails, like we talked about in Punta Gorda. All right, Molina first looks are out. Humana sent an AEP webinar invite. That's out. Scans AEP benefit rollout is there. Alignment AEP 2027 product rollout is out. Kelsey AEP prep and new broker portal is out. All of this is happening fast and furious. Ambetter, if you're doing business in Nevada, their open enrollment is from November 1st to January 15th because it's state-based. Penny, which is Pennsylvania, if you're doing that, their 2027 broker certification is open. Covered California, they're doing an OE kickoff in September. Check your email for that. There's a lot happening here, guys. And I may not have captured all of it, which is why I'm asking you guys to check your emails. Very, very important. All right. Going back over the comments here, Will saying he can't hear anything. I think everybody else can, so it might be on your end, buddy. There were non-commissionables. Rosie's saying there's non-commissionables in 2026 too. Only HealthSpring is the one paying PDPs, I believe. There might be a couple other ones too, but you can check that sheet. Mike and the team are trying to keep up with that. We just got the Aetna PDP news last week, so that's been added there as well. Baycare, yes, in Tampa General, changes in providers, but they're blaming the hospital. Hospitals and plans are going to be a thing that's never going to stop. I do not believe they have a PDP in Florida. Florida Blue PDP. That's a good question. I don't know about 2027, but I believe they had one for 2026. Anyway, you could check out the certification if you haven't done that. It should be in there as well. Justin, I don't know who this is from. Who's this from? Oh, this is Rosie. My team and I became RTS with Emeritus. Where can I find the payment structure? They told me I have to ask my FMO. You can always reach out to Liam on that, or just shoot over an email to support@askhpm.com. We're happy to track that down for you, Rosie. And I know you've got a direct line to Liam, so he can track that for you. Let's see. Ultimate, they come out with their 2027? Mike is confirming the resort is live. And in case you're wondering what Medicare resorts are live, you can come over to contracting and look at recertifications here, and you will see that these are the ones that are live. Okay, we've got Aetna, Baycare. Mike and team have been keeping up with this pretty good. Doctor's Health, Devoted. These are all live. The ones that are not live, you'll see coming soon. Okay, so Florida Blue is good. Health First is good. Health Sun is good. Right, guys? So you just click that. Like, for instance, Health Spring, it'll pop up, and some important information. Please read these. It'll save you a headache or three. Promise. The finance department can provide the ancillary grid. Yep, thank you. I need to resend the link for Simply with Florida only, please. Who's asking me to pay for my Texas license? Yeah, get with contracting on that, Rosie, if you're having some issues. Will, it looks like it's on your end. I don't know what to do, but you can try to call in. I think there's a phone number to call. You can listen in. These are being recorded, by the way. If you can hear me, or see me, these are being recorded on YouTube for your digestion later. Mike, non-commissionable resources will continue to be updated as we receive them. Thanks, Mike. Jose, please print enrollment kits as a backup if you don't have internet connection at the enrollment time. Great reminder. Thank you for that. Yeah, you should have at least one of each kit that you're selling in your trunk. Just in case. Sergio, Blue Medicare Premier RX PDP. Yes, thank you, Sergio. It is a thing. Appreciate that. UHC 2027 plans are live in Jarvis. Thank you, Tom. Absolutely, guys. If you haven't dived into the portal systems, again, certs should point you in those directions. The Humana virtual rollout is in the calendar for this Wednesday. Oops, yeah, I must have skipped that, but that's in there. And Rosie's reminding, if you're in Tampa, there's two big rollouts, Elevance and Florida Blue this week. So yeah, lots and lots happening. It's go time, guys. And I went a little bit over. So I've got Steven Mesidor on the line here. He is from, I'm going to stop sharing my screen. He is from Innovage, and he is going to give you the skinny on the PACE program and what they're doing specifically to help your clients that are high risk, that need a little bit more TLC. They have an incredible program. We've partnered with them. The agents that have been working with Steven and his team have been crushing it. Really excited for this partnership. So Steven, if you can hear me, take it away, brother.
Good morning, everybody. Can you guys hear me before we get started?
We got you.
Perfect. Thank you, Justin and team, for allowing me to be here this morning. But before we get started, I do have some exciting news for the Florida market. As of today, I just recently brought on a broker manager that will be responsible for the Florida market, and we are really excited to have her on board. She couldn't be on this call this morning because she's going through orientation. But her name is Layla Siciliano. Some folks may know her. She used to be with Solis a few years back, but end of age, we're lucky enough to have her on our team. So she'll be working closely with I and building stronger relationships with health plan markets and your agents. And she's a wealth of knowledge as well when it just comes to Medicare, and she will be when it comes to PACE. I'll make sure of that. So she'll be a great asset to be able to accommodate the ask. Also, we've had a lot of momentum this past few months. The last 2 months, we've hit record record breaking highs for our burger teams, for our burger sales. And we've gotten to the point where we are closer to 60 to 70% of our company's business now.
Wow.
So we are looking for the growth. We are continuing looking to partner with you guys when it comes to co-op opportunities. I know a lot of places, it's for a lot of carriers, it's been crickets, but I promise you, innovate, it's not. We will continue to find ways to partner up. With all that being said, we are getting ready to do, we're not doing a roll up this year, but what we're doing an open house where we are looking to do that close to the tail end of September to allow a lot of our agents and broker partners to be able to meet our clinical team, meet some of our leadership team in Central Florida and Tampa market. So Justin, team, I will get you those dates by the end of this week, so you can feel free to share it with everybody. And I would love to have you guys come by. But just to be efficient with everybody's time, there is a new document that I had our company build out. It's to help better create an idea for our broker partners how to truly identify who is a great candidate for the PACE plan. So I'm going to share my screen briefly just to share this document with you guys. Give me 1 second. Let me pull it up. So this is a document that we recently just built out, and it's basically a participant profile, right? It's a patient profile that helps to identify and put things into perspective of how an ideal PACE participant looks like. So this is something that all of our broker partners would have access to. It's actually on the broker portal in your sales and marketing resource tab. So again, if you go on there, this patient profile will exist right here. So basically it goes into what is PACE, but what's really unique about it, again, it gives you some good data about PACE and everything like that, and to transportation, to caregiver relief and all the other stuff. But what's really important, it actually builds a profile. Again, these are from real life examples. Of course, the folks on the pictures and the names, they're made up, but these are actually real life scenarios of folks who have come to us and their care goals, and why their family decided PACE was a great partnership, and why they chose us as a health plan and compared to the traditional other carriers. So, but again, I won't go through every single one, but we have I believe 5 profiles from Maria, who's the age of 70, from 78, who's an Hispanic woman who lives at home, and her family decided that she needed to join PACE because she was struggling when it comes to coordinating her care. And one of her main goals was to be able to stabilize her blood sugar, was able to find ways to stay out of a nursing home. And these are some of the ideas that our clinical team built out. So I've been getting a lot of questions, really a lot lately, was around, hey, Steven, we have a lot of folks who are dual eligible. We would like to send it to you. That's great. We would love to take every single person you send over. But again, we want to be able to make sure they're the right fit. Because again, you don't want a position where you enroll somebody into PACE and it's not the right fit for them, and you're getting a rapid disenrollment. So of course, when we're having these conversations with our clients, we want to truly understand what are their needs, what are they really looking for, what are they trying to accomplish for their health goals. And this document over here will help you paint a picture of what an ideal PACE participant will look like. So a lot of this at times is having conversations with not just with your client, but if you deal with their POA and their families as well, that plays a huge part, because PACE is not just a health plan that's accommodating the patient, but we're truly partnering up with the family as well. Statistics shows you that we're reducing caregiver burnout from anywhere from 45 to 55% when it comes to partnering up with families. This is truly, truly a partnership. So again, these are just a few documents. And again, this right here, I could actually just put it in the chat for everybody, and they'll be able to quickly open it up at their own time, at their own leisure. But feel free to go through this. It helps put a better picture of who is a great PACE participant. And if you could identify anybody like this on your current book of business, we're truly looking to partner up with you guys and help those families. And I know, again, I like to throw this out here. And again, Justin, I'm going to keep it very, very short today. But I want to throw this out here. We understand we are in a position where we're starting to see a lot of health plans go non-commission, where it's affecting everyone's livelihoods, of course, because you guys do a lot of work, and sometimes brokers are playing social workers, and you guys aren't. There's a lot of work that you guys have to do. I have brokers that I've partnered up with who've told me that they're taking their clients groceries, they're bringing them to their doctor's appointments, they're ordering rides for them. That is a lot of work. What I want to say about Innovate is that a lot of those service calls that you guys used to be able to have to circumnavigate, Innovate would be able to handle all that for you guys. We have everyone is assigned a social worker and a case manager and a registered nurse who would be able to help with any of those issues. Also, when it comes to the commission side, we're paying you to Medicare for every person that comes through the door. We're not playing with your commission. The way we do it, again, it's very little to no risk. For example, you write an application for your client, they're with PACE for 90 days. On the 4th month, they come back to you and like, hey, Rosie, I don't think this PACE plan's the right fit for me. That commission we pay to you guys, a dollar would not be owed back to Innovate if it's post 90 days. There's nothing's prorated back to you guys, nothing. Even if we pay a renewal, once a renewal is paid, and the renewal is usually half of the fair market value, paid on the anniversary of when that person enrolled. If that person decides to disenroll after we've actually paid a renewal to you for the whole year, for the whole calendar year, nothing's owed back to Innovate. Everything is paid in good faith. The only time a dollar is owed back to us is if there's a rapid disenrollment. Typically, that doesn't happen. We only have a 7% attrition rate, which is relatively really low for this industry. So again, I just want to throw it out there. We are truly looking to partner up with you guys. We understand you guys put a lot of work into the kind of stuff that you guys do out in the community, and we want to be able to make sure you guys can be rewarded for it. Also, we are increasing our rate to $7.25 for the state of Florida come January 1st. So again, we will be increasing our commissions. Also, that would also increase the renewal rate as well. There is one more thing I do want to address, is that we actually have our certifications online right now. We do our certifications a little different compared to the other carriers. For folks who've already been who recently just got contracted with us after August 1st, we won't have to do the recertification, and they should be covered all the way to December of 2027. If anyone who contracted prior to August 1st of 2026, they would have to redo it. They would have to do a recertification. It's relatively very simple. It's 10 questions. The video is around 25 to 30 minutes. We added some new updates into some things that might have changed in certain markets. Again, you could go through that certification in probably 30 minutes. And if anyone's contracted with us, it's the same exact questions that we've asked when you first got contracted. So it's relatively simple. And we give everyone up to December 31st at midnight to complete it. So we understand everyone is up to their neck with certifications. Again, Innovation didn't want to bombard everyone else with another one, but it's required for us to do one a year. So based by CMS regulations, so we give everyone to basically December 31st at 11:59 p.m. to complete it. So again, you have some time. Again, I would definitely say, again, if you could knock it out right now, just do it, and it will cover you basically till December of 2027. So it'll cover you for a long time. But with all that being said, again, we are truly looking to find ways to continue to partner up with you guys. Please use this document. It's on your sales and marketing resources. I'm going to enter it in the chats right now. So again, team, thank you for the time. And again, I will get the date for our open house for Orlando and Tampa to you, Justin, and your team by the end of this week.
Awesome, man. Thank you very much. So we have some questions in the chat here.
Incoming call.
Oh, sorry. All right. So in the chat, we've got Albert. He's asking, Albert's asking, well, first there's a shout out. So Rosie says, thanks for participating in the NABIP Medicare panel. So appreciate that. And then Albert's asking, where do you find the patient profile? Is that something in the agent portal?
It is in the agent portal. I believe I just put in the chats right now for the link to the agent portal to be able to access that. but let me put the PDF link right in the chats right now, so the team could just have it right now. But it does exist in your broker portal.
Awesome. And before I forget, if there's recertification info, would you mind sending that over to Nick or Mike? Because we want to load that in HQ as well if we don't already have it. I don't know, Mike, if you've got recert info on Innovage. We want to make sure that it's easy to click. And I'm going to show them how to get contracted here in just a minute, Stephen. But yeah, if you have info, let us know.
Yeah, most definitely. So for everyone who's currently contracted, it would literally pop up as soon as you sign into your portal, if you're contracted or not. So it's self-service. But Justin, you as the FMO as well, there is an FMO sort of recertification that you guys have to complete. So again, again, it's relatively very simple. It takes about 30 minutes to go through the video, 10 questions asked. So it's relatively simple. And Richard, I did see if there's PACE in Brevard County. Not 100% sure, but I can give you a website to always be able to source where there is a local PACE provider. So it's through the NPA, which is the National PACE Association. I could give you a finder that helps you circumnavigate, being able to identify like where is the nearest PACE provider for a certain area. So let me enter that in the chats as well.
But you guys do not yet have a facility in Brevard County, is that right?
No, but there may be another organization in Brevard County. Again, we're the largest carrier for PACE in the nation, but the state of Florida has pretty good coverage for most of the states. So I believe I shared this before. By 2030, every county in the state of Florida should have access to PACE, and majority of them are now starting to contract and partner up with brokers. There is a newer program coming into the market as of 2027. They should open mid-market, and they are going to be near the Volusia County area. I get asked that a lot, and there's going to be another one that's going to be in Polk County and south of that. So again, most of Central Florida would have coverage.
There you go. All right, so get ready, guys. It's coming. And to that point, this is something that I think a lot of agents are sleeping on right now. And by the way, guys, kudos to all you guys on this call. There's over 70 agents live on this call, Stephen, by the way. And then the other ones are still in bed and they're going to miss this information. I'm just kidding. I love them, but maybe they're in an appointment. We'll give them some grace. However, I just want to point out, guys, we're doing these calls for you. You're showing up on Monday morning at 9 o'clock and you're getting incredible information from guys like Stephen that you cannot find anywhere else. So we're doing these calls for you. I just want to say thank you to the 70 plus agents that were on this call for you and listening to this morning. Y'all should give yourselves a clap on that. And we need more information on PACE because this is a newer program. Guys, you can lead the pack. You can lead the pack if you lean in early. And this is what this looks like right now. This is a program. You're leaning in early. You know how many people I've met that leaned in early for Medicare Advantage that are literally millionaires now? Like, this is the type of stuff that's happening. How much is the commission again, Steve?
Max fair market value. So right now, $694 for today, $725 starting January 2027.
$725 for literally sending your patient over. They do everything, and you're getting paid. $725. Meanwhile, the MA plans are struggling and they're not getting paid. They don't want to pay you, but Steven's got money just flying out of his ears that he wants to give to you. All right. Like wake up, guys. If you don't know about PACE, you're gonna miss out on this. But Innovage specifically has beautiful facilities. The docs are great. The plan is working great. Your patients pay nothing. If you have Leela's information, if you don't mind dropping that in the chat. If not, how do they get a hold of you?
Yeah, so let me put her email address in the chat. Her work phone number, I don't know that yet, as if today's her first day. Good. But I can actually put her email address in the chat for everyone to be able to have access to.
Yeah, so for now, CC Steven, I think would be a good idea, if you don't mind, just to make sure that she gets up to speed. But yeah, guys, if you need help with any marketing or anything that you want to do with them, by the way, he popped in the link to the brochure he was sharing earlier, the flyer he was sharing earlier, and then Mike made a downloadable file in the chat. I don't even know how he does that stuff. Mike's incredible. Thank you for that. But he's got that loaded in there as well. And then Jose was asking, who do you contact for to coordinate co-sponsorship for community events? I'm assuming that's going to be Layla in the future.
Yeah, so
right?
yeah, Layla or I, again, just because Layla's here doesn't mean I won't be around anymore.
Yeah.
As this market continued to grow, we needed more support, and Layla was somebody that came on board, and when I knew she was available, I could not resist. So again, we're really happy to have her. But there's one more thing I do want to say though, to show you how much success we've had this past month. At August 1st, I literally had one agent who had 20 sales for me.
Wow.
First.
Wow. 20 sales?
20 sales. And the way she does it is she utilized our center as a resource. She brings her clients in for tours. We get to do this thing called a day in the life of PACE, where their clients could come in, tour the facility. We always recommend it around lunchtime, which is usually around between 11 and noon. And towards the end of the tour, they get to sit down with the other participants and partake in the lunch.
Bro, hold on a second. I need to do some math real quick in front of these guys. 20 sales a month. Okay. I don't know if I can share my screen. I'm just going to share. Let me see if I can share my screen here. This is what I'm talking about, guys. Hold on, let me clear. I don't want to.
And if I could legally show you her commission check, I would.
Oh, I'm about to. That's what I'm doing right now. You guys should see my calculator on the screen. So I'm going to do the new rate for 2027 is $725. Okay. Times 20 sales a month. That's a $14,500 check. Am I right?
Yep. And when I tell you she was ecstatic, and just to let everybody know, Innovation does all the hand-holding. When it comes to applying for Medicaid, we have our own Medicaid team, so you guys don't have to go through My Access and apply for the long-term care Medicaid for your clients. We literally do the whole entire process. All you have to do is communicate with your client, speak to them about the product, and Innovate will do the rest. And when you get, again, of course, we'll communicate with you if there's any bottlenecks that happen. But when the person enrolls, you get compensated by the third Friday of every single month. So commission day was literally this past Friday, and that agent got a wonderful check direct deposited in her bank account.
While I'm doing this, Mike, if you don't mind, if you could track this down really quick because you're a wizard, the YouTube episode, the podcast of Steven that we did a whole podcast on, because I'm seeing questions in the backside, describe an InnovAge patient, do you provide transportation to appointments? We cover all that in our podcast interview that Steve and I did. So you can run out there and do that, or you can reach out directly. But I want to share with you guys, and Mike, thank you for popping that in the chat. If you can chase that down, I appreciate it. It's also on the closed. That's what I'm talking about. Is our closed podcast that I do. There it is. Boom. Thanks, Mike. We go through the entire program and talk about it. And it's an awesome episode, by the way. You crushed it on that. But here, guys, if you're like, okay, I'm ready for this thing, I want to get started. How do you get started? You should see my screen now. You're going to go to contracting. You're going to go to request a contract, and it's all alphabetical. You can type in InnovAge right there. You're going to click that button, and it will ask you if it's a new or transferring contract, and you have instructions on how to follow. So Rosie's saying it's a great program. Get contracted. I don't know about you, but 14 grand is life-changing money, guys, especially if you're doing that a month. That's nuts. That's crazy. It's crazy. Like Steven, like, dude, save some of your money, man. You're gonna go broke over there.
So again, we're really excited to find ways to continue to partner up with you guys. So again, feel free to reach out, and I'll enter my contact information and email address in the chat, so that way you guys can have it. So again, we are looking to find ways to partner up. AEP's coming around this past Saturday. We hosted an event at a local church where we had 300 people show up, and we had 300 bags of groceries ready for them as well. So we are finding ways and I did that with an agent, by the way, that was tied to HPM. So shout out to Lorna and her husband. So they were the ones who did that. So we are finding ways to partner up with you guys. We want to continue to partner up. So don't hesitate to reach out to me. We are very strategic when it comes to our growth plans, and we are here to stay.
Awesome. Last thing, my Georgia girl Gail, she's asking, when are you coming to Georgia?
No,
ready. Yeah.
So there's actually the state of Georgia just actually approved for Pace Carrier to actually come into the state. It would right now there's an RFP process that multiple organizations are bidding for, and it will be in the Fulton County area.
There you go. Awesome. So it's coming soon. Amazing. All right, guys, we are out of time. I see some other questions there. Andrew's asking about the the typical patient and do you provide transportation? Again, Andrew, if you could look in the chat just above you there, watch that. That's going to answer that question and so many more. Really appreciate your eyeballs on that, because we're out of time and we won't have enough time to go through all that. And then Rosie's the Pasco location, just quick update. Do you have anything on that?
So there's actually a new company coming into Pasco County. They're called Boat Age Pace. They opened their doors at the end of, I believe, the beginning of 2027. And they're also going to be the same one that's going to be covering Volusia County as well. So they have two locations coming into this market. We are not associated with them. But again, one thing I want to say about Pace, I'm a big advocate for Pace in general. All Pace carriers are regulated the same. They're regulated to offer the same benefits. Operationally, they may be a little different, meaning that, for example, NFH offers a beauty parlor. Most Pace organizations won't do that. So like small little things like that are going to be different, but organizationally, the way the clinical model works, the way the benefits work, they're all the same.
Beautiful. All right, guys. If you have more information or if you need more information, Steven's info is in the chat there. It's Smezidor, SMEZIDOR at innovage.com, INNOVAGE.com. It's in the chat. Phone number 561-890-6237. That's to his bat phone. He answers 24/7, 365. I'm just kidding. He doesn't do that. But text him. He'll get a hold of you, and he'll make your wildest dreams come true. If you show up, go find patients together, make some money, change some lives. That's what it's all about here at HPM. Awesome, guys. Steven, thanks, brother. I really appreciate you being on this call. Excellent job as always. Really appreciate your time.
Thank you, everyone. Take care. Have a good Monday.
You got it, brother. Okay, guys, that's it for this week. I'm really proud that all of you stuck around this long to listen to me yak. But if you have ideas on what you want to see, what you want to hear, ideas, guys, I'm bringing this for you. I do this for you. I wake up early to bring you this information. I'm really, really excited to move the needle for you guys. Okay. I'm invested in your education. I'm invested in your income so you can go out there and help people. Okay. That's it. Thank you, Rosie, for the kind compliment. I appreciate that. Go out and get contracted. Have a great week, guys. If you bump into an HPM agent, remember, or another agent that's looking for an FMO that is as engaged, is as knowledgeable, and as tech forward as HPM, if they need a home, spread the word. Guys, we want to, I'm out here saving agents' lives and headaches. That's my job. My job is to bring you guys this. And if there's boneheads out there that are like, I don't know what to do, I don't know where to go, I'm not getting what I need, share the good news, guys. We really, really appreciate it, because that's what we do around here, especially if they're already hooked up with HPM and they're like, I don't know what's going on. It's because they're not on this call. 100%. It's because they're not on this call. Okay. You see how much work we put into this thing, And by the way, this is exclusive. We don't put this out on the internet. This is for you. You can only get it here. So, and I'm not tooting my own horn. Like, look at the team members that are on this chat. They're putting together. Nick's he's chasing down guests. John's making sure I don't mess up. Mike's here to make me look good. You know, we're all doing a job. We're all doing a job. So guys, thank you for being here. And in the meantime, if you have any ideas for the call, you can email me. I'm going to put my direct email in here. You guys know that that's there. And then also my phone number. I do have an assistant. She helps me. I don't always answer the call because I'm jammed up a lot of the times, but you can call or text. I read everything, especially if it's from you. Okay, that's what I do. All right, guys. Thank you very much. Have a productive, fantastic week. Go get your certs done. Go to the rollouts. Go get your contracts. And we'll see you on Monday. Have a great week.